Welcome back. Now, the Gauteng Health Department and civil rights group Section 27 have faced off in court over radiation and surgical backlogs. The organization accuses the department of having misused the more than 780 million rand allocated to treat hundreds of cancer patients. For more on this story, I am now joined by Khanyi Mapipa, who is the head of the Health Rights Program at Section 27. Khanyi, thank you so much for the time. Really appreciate it. You've headed to court. What's the latest you can perhaps share with regards to this issue?
So on the 21st of November, we had a hearing on this issue. Section 27 represents the Cancer Alliance. And in the proceedings, the Cancer Alliance is asking the court to declare the conduct of the Department of Health in failing to provide these radiation oncology services unconstitutional and unlawful. Further, the Cancer Alliance is asking the court to mandate the department to provide these services or to take all necessary steps to make sure that these services are provided. And then lastly, the Cancer Alliance is asking the court to interdict the use of the 250 million rand that has been ring-fenced of the 784 million rand, to interdict them from using that money for anything that is not planning, that is not radiation oncology services. What we know is that the department has undergone a tender process and awarded a tender for planning services, which are not treatment of cancer. And what the Cancer Alliance is saying is that this step in awarding for planning services that are not treatment is irrational, and that the court should interdict and set aside interdict in the meantime and set aside that decision in Part B of the application.
Yeah, what is government saying then with regards to this? And I know it's the other side of your own very conversation then that you'll pretty much be having. But why is there this backlog, you feel? Why do you think that they've been unable to provide the kind of treatment that is needed for more than 3,000 cancer patients as well? And then spending more than, again, 16 million rand, if I'm correct, then on salaries for suspended staff?
Yeah, so they've had a number of answers to this very question. And this is the question that the court asked as well. The responses have been, they lack machinery, they lack the sufficient staff to do the job. There was a fire at Charlotte Matleke, COVID-19 happened. So just an array of excuses as to why they haven't been able to historically provide these services. However, what they haven't been able to answer is why they haven't been able to provide these services after Treasury had made a special allocation for these services to be provided in the private sector, and all that Gauteng Department of Health had to do was to go through a procurement process and appoint the necessary private sector practitioners to provide these services, while they themselves get their house in order, while they buy the necessary machinery, while they appoint the necessary staff, because Treasury and civil society organizations who lobbied for this understand how dire and how urgent cancer care is, that it could not wait for the department to capacitate themselves internally. But they still haven't been able to answer the question as to why they haven't used this money in the way that they were directed to by Treasury.
Yeah, Khanyi, what happens though? You then, if you get the decision in your favor, which is to declare the Department of Health unconstitutional in this matter, then what exactly happens then? Does that not incapacitate them from being able to actually do the very same services that you want them to? Or does this then mean that it enforces that they must then commit to doing those tasks?
Yes, I think the latter, definitely. So our hope is that if we get this court order, it will firstly validate the experience of so many thousands of people who have been waiting services and being told that, if the state doesn't have the resources, then you don't have the right. It will validate those people's experience to say this thing that's been done to me is unconstitutional and is unlawful and ought to not have happened in the manner that it did. But also it will force the department to act, because as a Department of Health, they are the custodian, particularly of Section 27 of the Constitution, that provides for the right to access healthcare services. Now, if I may just say, that right is most of the time limited to the available resources within the state. But in this case, we have quite a unique case in that resources have been made available and the state is still failing. One thing that we have learned that I just want to add in the time between the hearing and now is that the department has actually failed to spend the money that has been allocated, and part of that money has been returned to Treasury. And so what we're again fighting for is for the department to act before further money is taken back to Treasury, and they are left actually with nothing or back to square one, where they have no resources, no internal resources to provide, and also no financial resources to outsource these services to the private sector.
Do you believe that something should be said then about who are the administrators of this funding? And I talk just within the government departments themselves, and also those then that are in charge of and have a responsibility towards not just the oncology and radiation departments, but really a lot of other departments as well, which may be facing a similar concern.
Yes, definitely. I think it has to be an indictment on the particular individuals who run the department and also who run this particular internal department, the Department of Hospital Services. We have, as civil society, been lobbying and been speaking to people within the department for years now. This particular process started in early 2022 and has continued up until now, and yet not a single patient has seen access to these services. I think there has to be something to be said about the lack of urgency, the lack of care, the lack of understanding of the harshness of this disease and the life-changing implications that not receiving treatment has, not only on the patients, but also on their loved ones and the people who care for them.
I want to go into a slightly broader question then, Khanyi, if I may, and that's really just around whether you believe the Gauteng Department of Health is sufficiently funded. I know you spoke just now about funding that actually returns back to Treasury, which in itself may actually just be a misallocation. Of course, they could have many other reasonings as to why that happens. But is it sufficiently funded for the needs that are necessary then within the province?
So in terms of resources, as an organization, we often analyze the budget and what monies are given to the Department of Health. And as a whole, the department could definitely use a lot more money than what it is allocated. But often we see this practice of underspending, where money that is allocated, that is provided for specific line items, is not used and then returned to Treasury. And obviously Treasury's response to that is to say, well, if you're not using it, it means you don't need it. And then the next time I will give you less. And so every single year, we see this practice of austerity where the department is getting less and less and less funding, not only because of the dire economic situation that we find ourselves in as a country, but also because they themselves are not making use of the money that is being made available to them and are therefore indicating to Treasury that they don't need that money. I think that there are certain capacity issues definitely within the department that prevent them from doing what they need to do or providing the services that they need to provide. But I also think that the department is quite plagued with corruption. There is quite a bit of corruption within the department, as we've seen with the COVID-19 saga, as we've seen with the Tembisa saga, and as we've seen more recently with the freezing of posts and other micro medical legal issues that we've seen within the department.
If you don't get the decision your way, when it comes out then, and they're not declared unconstitutional as well post that hearing, and the judgment doesn't go your way, what is your recourse? What is your action after that?
Well, we are certainly hoping that the judge will see it our way. we're certainly hoping that, the plight of the thousands of patients that we represent will be heard by the court. But certainly if our efforts fail in this regard, I think we might have to go back to step one, which has been to try and lobby the department to do what it needs to do. We've taken to the streets, we've protested, we've formed task teams with the department, we've done almost all the things that we could do outside of the court process. And really, so this is our last, it's the last hope for most of these patients to be able to get this treatment that is life-saving, that they desperately need.
Yeah, and I was about to ask that very question, whether, all other avenues have been explored or not, and certainly sounds like they have. Khanyi, appreciate the time. Thank you so much. We certainly eagerly anticipate then that judgment, and we'll get more word on that then hopefully as well. Then that is Khanyi Mapipa, who is the head of the Health Rights Program at Section 27.